Hi, welcome to You and Your Health. I'm your host, Dr. David Bertone. Today we're going to talk about sleep breathing disorders. According to the National Sleep Foundation, approximately 80 million Americans have some form of sleep breathing disorder, or commonly known as sleep apnea, and up to 80 to 90% of people are undiagnosed. Today we're going to learn what can be done to help people with sleep disorders, and our guest today is Dr. John Young. Dr. Young is a board-certified orthodontist and also board-certified in dental sleep medicine, and he has practices in Colts Neck and Brick, New Jersey. Dr. Young, welcome to the show.
Thank you. Thank you for having me.
So, give us a little bit about your background and how you got involved in dental sleep medicine.
Well, I'm an orthodontist, and I've been practicing orthodontics for 20-some-odd years. About 10 years ago, I was diagnosed with severe sleep apnea. I had snoring. I went to the doctor. Had a sleep test done. I had severe sleep apnea. Tried wearing a CPAP, which is the gold standard treatment, and I just was unsuccessful with it. So at the time, there are dental appliances to treat sleep apnea, and simply the way we treat sleep apnea with dental appliances by positioning your lower jaw forward to open up your posterior airway or your throat and prevent the throat muscles from closing while you sleep. Back then, the appliances, they had a lot to be desired. So I started working on and wearing all the different appliances to see which ones worked and which ones didn't, and kind of developed a protocol and an appliance that really works for myself, number one, and now for my patients.
Okay, great. And I personally have been suffering with this for a few years and have come to see you.
Right.
And I'm learning a lot more about it. So let's talk about some of the common sleep disorders. So everybody knows about sleep apnea, but apparently snoring is actually part of it, right?
Yeah, I guess snoring would be considered a sleep disorder. And snoring necessarily by itself is not pathological.
Okay.
But probably 2/3 of the people that snore do have some form of breathing disorder, most likely sleep apnea, especially if they snore and they kind of stop breathing at night, or they pause, or they wake up choking or gasping for air, which I hear a lot from their bed partners. That means you have sleep apnea, and your breathing is affected at night.
Yeah, so the bed partners, as you say, obviously you're not going to be aware that you're stopping breathing, but somebody that you're sleeping with, hopefully.
Some people do. Some people
that.
are actually aware that they wake up choking or gasping for air, and their heart's beating a mile a minute.
Wow.
And that's the response that the body has to deprivation of oxygen. But usually we get the complaints, and actually usually the sleeping partner is the one that sends the patient in for treatment.
And are there other types of sleep disorders, or sleep apnea the most common? Or
Sleep apnea is definitely the most common. I mean, there is insomnia where people cannot get to sleep. That's more of a neurological problem.
Okay.
But obstructive sleep apnea is the most common, and that's what we deal with. The reason they call it obstructive sleep apnea is because apnea is when someone stops breathing totally for at least 10 seconds while they sleep. Could be up to 30 seconds in some cases.
Wow.
Yeah, it's a problem.
Okay.
And what happens is it's called obstructive sleep apnea because the person is trying to breathe. Their chest is going up and down, but the throat muscles close.
Okay.
Especially when you're in deep REM sleep and your muscles relax throughout your whole body, the muscles that usually keep the airway open or patent collapse, and your airway collapses.
So I know you have a model that depicts that. Can you show us or explain that a little bit more detail?
This is kind of like an example of what your muscle looks like in your throat. Let's say these are your muscles that kind of collapse while you sleep, and you can see that the hair cannot get in between or cannot get into the lungs.
And that's in the center there, the red part?
This is your throat. Let's say it's collapsed. Okay. Now, normally the treatment with the CPAP, what a CPAP does, it's a face mask you wear that continuously blows air into your nose and into your mouth, and it blows these tissues apart.
Okay, so it opens
up the airway
space
by forceful air pressure. But a lot of people find that uncomfortable and hard to wear. It dries out your eyes, it dries out your sinuses, and it leaks. So people have a lot of issues with the CPAP. So we do instead, what we do is we just take the lower jaw, and if we move the lower jaw forward, we open up the airway that way. With an oral appliance, and that's the rationale on how they work.
Okay. And obviously, as an orthodontist, that's something that you've been doing your whole career, is repositioning teeth.
Yeah, repositioning teeth and jaws. Jaws mostly in kids. We make their jaws grow if need be. And adults, we do it to open up their airway for sleep apnea reasons.
Okay. So now, what is happening physiologically to the body during sleep apnea? We hear about all these different medical things that can occur, and it's in the news quite often. We're learning now that some of the conductors that have had issues with crashes
especially
had
recently.
sleep apnea. Yeah,
Right.
and so maybe they're going to start being tested for it. But what are some of the physiological things that are going on to the body during this
Well, here's how it
process?
affects you in the short term while you're sleeping. When you stop breathing, what happens is your body and your brain senses in your blood that there's oxygen levels dropping. Normally, oxygen levels should be between 90 and 95% in your blood. Now, when your brain realizes that your oxygen level is dropping, when you have sleep apnea, and your throat closes and you're not getting air, your oxygen level drops to 80, 85%, 70. I see people that drop to almost 70% during the night. And your brain realizes that very, very quickly.
Okay.
And when it does, it causes your body to almost have a fight or flight response where it says this patient needs to breathe, otherwise they're going to be in trouble. So your body releases cortisol and epinephrine right off the bat, and in an attempt to kind of wake you up to have you breathe. Now, what that does is that increases your heart rate. It also kind of jolts you awake to breathe, and those are what we call arousals. So if you're having arousals all night long because of sleep apnea, you never really get into that good REM sleep that you want, that restorative sleep, because you're getting bounced out of that with these arousals all night long.
Okay.
So it's not good for your body systems to be deprived of oxygen, plus you're not getting REM sleep. So you wake up in the morning, you slept all night, but you feel horrible in the morning. Morning headaches, people wake up with headaches and they feel excessively sleepy during the day because of that.
Okay. What about some of the other things that are happening to the body? So the cortisol is released and epinephrine and your heart's racing.
Right.
What else is happening to the body during that process?
Well, because of that, what you're prone to having, first of all, being obese. People have problems with their weight because they're not sleeping well, and because of this. They have a problem with hypertension, high blood pressure. They have a problem with, some people have heart failure.
Wow.
Diabetes is associated with sleep apnea. Alzheimer's disease. There's studies that show that the onset of Alzheimer's is increased or sped up by the fact that you deprive your brain of oxygen all night long. Also, depression. Men sometimes have erectile dysfunction directly related to sleep apnea, and it could cause death. How many people driving home from work fall asleep at the wheel because they're excessively tired and get into car accidents?
Okay. So what are some of the common symptoms of a sleep disorder? I know snoring is one of them, and I know when I came to you, you fill out kind of a questionnaire, and that gives you a grading. Can you explain that process?
Well, yeah. I mean, snoring is the biggest tip-off. If someone has excessively loud snoring, that's a big tip-off that they might have sleep apnea. Also, if their bed partner senses that they stop breathing for a little while, doesn't hear breathing, and then they kind of wake up choking or gasping for air. In the morning, if they wake up excessively during the night. Some people think they wake up during the night maybe to use the bathroom, but they're actually waking up to breathe, and that sometimes keeps them up. In the morning, if you have morning headaches, that could be a sign that you're not breathing well, that you do have sleep apnea. If you're excessively tired during the day, if you can't focus at work, that's another symptom. If you fall asleep driving home from work, which was my problem way back when, that's a sign that you're not sleeping well, or even if you're sleeping, you're not getting good REM and good restorative sleep during the night because of your apnea.
Now, what is the process for diagnosing sleep apnea? I know the gold standard is this polysomnography, is kind of a way you're in a sleep center and you're observed all night long.
Up until about 5 years ago, that was the gold standard and the only way to test for sleep apnea.
Okay.
You would have to go spend the night in the hospital and wired up with...
and they observe you and measure things?
They observe you, they measure everything, and that's the way to really observe and diagnose sleep apnea. But in the last 5 years or so, there's many home sleep methods that have come out, testing units, that give us almost as much information as that, and they're easier to wear.
Okay.
And you don't have to spend the night in the hospital. And it's a little more representative, some of them, of your actual sleeping pattern. When you go to the hospital, you're in a different setting, and you have all the wires, and your bedtime might be different. The home units are nice because they give us the information that we need, number one, and number two, you're in your own setting like you normally are every night. So it gives us a representative of what happens every night for you.
I know you have a sample of one. Can you show us what it looks like and what it's actually doing and what the process is?
This is one of the units that I like the best. It's a head-mounted unit. It has a headband with all our sensors everything as far as blood oxygen level, stages of sleep, has a nasal cannula that measures the breathing. I like this one the best because personally I'm a stomach sleeper. And some of the other units have like a little pack that all the wires connect to, so you can't really sleep on your stomach. So again, you want to sleep like you normally do.
Sleep, yep.
So I kind of like this unit the best, but there are a few different ones out there, and a bunch of doctors that I work with all have their own preferences.
And what do you? And so it's the sensors are on the forehead. What is that? What is that measuring?
It's measuring blood oxygen level.
Okay.
There's brain sensors that measure your sleep stage. Measures your body position. You can tell what position you're sleeping, on your back, on your side, which is kind of important with diagnosing.
So then
apnea
you
as well.
get this report,
Right.
and I guess the data is uploaded, and then you analyze the information.
Exactly. Mainly what we're looking for when we're analyzing this is we want to see how many times an hour the patient stops breathing. That's one of our biggest factors. So when I did my initial sleep study, it told me that I stopped breathing 46 times per hour for more than 10 seconds. Not per night, per hour. So, and when we measure apnea, anything over 5 times per hour is considered you having apnea. So if you stop breathing more than 5 times, 5 to 15 times is considered mild apnea. 15 to 30 times is considered moderate apnea. Anything over 30 is severe sleep apnea.
And then all those bad things are going to happen once you start doing this over, and it's undiagnosed, right? So all these other metabolic things and health issues develop.
Right, especially if it goes untreated. So
now, are there any other types of device? I know people are using things like Fitbits and Apple Watch and things like that to check how they're sleeping, but that's not going to measure oxygen, right?
it doesn't. I mean, some of our patients use those to kind of measure their snoring and see before and after their appliance and monitor themselves. And I think it's a great thing.
Oh, okay.
But,
So it's a
but they
good
don't
adjunct.
give us as much information as the home sleep testing units do.
Okay.
That's why insurance pays, medical insurance pays for these.
Okay.
Because it works and it is diagnostic. And it's what we need to show the insurance company that the patient has sleep apnea for them to pay for the oral appliance if we go that route.
Okay. So are people still doing the hospital-based
They are.
sleep analysis?
In severe cases, a lot of times, the patient needs to really, even if we test them at home and they come up really severe, we want to send them to a hospital to do a full PSG to see what's going on. Also, sometimes if a patient wants to wear a CPAP unit, they have to go to a hospital to be titrated with a CPAP. That's hard to do at home.
Okay.
So they have to go to the hospital to have that titration done, which some people find annoying to do that.
So let's talk about the CPAP, because I know that's been out there forever. And how long has that been around, and when was that invented?
CPAPs were probably invented in the late 60s, early 70s, very rudimentary at beginning. And then, they kind of evolved over the years, but they haven't changed probably in the past 15 or 20 years.
And I know they're what does it stand for, CPAP?
CPAP stands for continuous positive air pressure.
Oh, okay.
So what it is, it's a mask that you wear over your face, your nose, your mouth, and some both combination, and it just forcefully blows air continuously into your lungs.
Okay.
So
there's been some ads recently. They're coming up with mini devices.
Right.
They're trying to make it small, because I know the original ones were real big and bulky.
right, they do have. I mean, the units themselves are not that big now, but they do have. They do advertise mini CPAP units on TV, on the radio. They're okay, but they don't work as well as the regular.
They don't have the
units do.
force of the air pressure. Is that what it is?
Exactly. Plus, the battery life is not too great.
Got it.
Also, the nice units we have, they have humidifiers on them as well. But
Oh, okay.
But
I was on a flight last week, and somebody had a CPAP machine on a flight.
a mini CPAP.
Yeah. So is
Right.
that something that's allowed? Is that FAA?
I guess
allowed?
it is. Yeah.
Yeah.
I guess it
'cause
is.
It must be certain machines that allow that. What are some of the other, after the break, we're going to talk about the dental options, but what are some of the other behavioral options for? Do you work with like a psychologist or people in terms of maybe there's other things in their life affecting their sleep, or is it all physiological?
Well, the biggest thing is, I mean, especially when myself and most sleep MDs, first thing you want to do is lifestyle changes.
Okay.
Losing weight helps somewhat. It's hard to do for some patients. So sometimes we do positional therapy where we alter the patient's body position when they sleep, because apnea is most likely worse when you're on your back or in a supine position because of gravity. That helps the tissues close if you're on your back. So we try to do positional therapy. But again, most people would try to lose weight. If that doesn't happen, most doctors would typically put them directly on a CPAP.
Got it. Okay, so when we come back after break, we're going to talk specifically about the dental appliance and how that can be used to improve your sleep apnea and improve your quality of life.
Why is Connor having trouble focusing in school?
Having trouble finding Connor's middle school? Would you like directions?
No, why is Connor having trouble focusing in school?
Finding lowest airfare to Istanbul.
No, I'm tired of fighting with him over homework.
Home, walk, restaurant. Need a review?
No, I need help. He's very smart, but his mind wanders. He's disorganized.
I think I understand.
Oh, good.
French fries. Finding best potatoes.
No!
Russet. Fingerling. Yukon Gold.
Why don't you understand me?
Sorry, I was trying to show how Connor feels every day. Frustrating, isn't it? Redirecting to understood.org.
For the 1 in 5 kids with learning and attention issues, this is what life can feel like. Explore understood.org, a free online resource about learning and attention issues, designed to help your child thrive in school and in life. Understood.org, because understanding is everything.
Drop that baby.
Don't worry, 74 people were picked before me in the NFL draft.
To fight childhood obesity, United Way and the NFL are helping kids play at least 60 minutes a day.
Okay, time for the team obstacle course. Yay!
What this place needs is more healthy kids. To get involved or donate, go to unitedway.org/play60.
Now I get it.
Welcome back to You and Your Health. I'm your host, Dr. David Bertone. Today we're talking about sleep breathing disorders with Dr. John Young. Dr. Young is a board-certified orthodontist and also board-certified in dental sleep medicine. Welcome back, Dr. Young.
Thank you.
So when we finished before the break, we were talking about the CPAP machine, which
Right.
is, everybody has heard the term, and especially that has sleep apnea. Let's talk about some of the cons about sleep apnea and why a dental appliance may be the preferred choice.
Right. Well, the cons as far as the CPAP. CPAPs, if worn correctly, they work. So that's the pros for the
Okay.
CPAP. The problem is a lot of people complain about CPAPs for various reasons. Probably the most common is the fact that a lot of people feel claustrophobic wearing a mask all night long.
Mm-hmm.
Also, the continuous air pressure sometimes tends to dry out people's sinuses and dries out their eyes and have a negative reaction in that way. Some people also feel that wearing a CPAP, they don't like the noise, and they feel like the hoses kind of constrict their movement. If they turn over the nose, the hoses kind of wrap around their neck, and they feel uncomfortable. Some people are allergic to latex, and they can't wear a CPAP mask. So my main concern when I had a CPAP was that it used to leak. I couldn't get the right mask that would not leak, and it was once it starts leaking, it's annoying. So it would wake me up more than it actually let me sleep. So
it kind of has to fit the face
has
perfect.
to fit perfectly,
Yeah.
and everyone's face is different. And there's a lot of different types of masks. Finding the right one is sometimes hard to do.
What about sleep positions for people? Is that a problem?
Stomach sleepers, like people that are restless, they're on their back, they're on their stomach. The hose is somewhat of a restriction with that as well. Plus, a lot of people that travel have issues taking their CPAP, especially if they travel out on business with them.
Yeah, I went on a motorcycle trip last year, and my buddy, he had it strapped to the back of his bike. So now he could stick this in his pocket. It'd be a lot easier. All right, so let's talk about the oral appliance option and the pros and cons of that. Talk to us about some of the different appliances that you have here.
Well, there's a few different appliances in all different designs, depending on what the patient's symptoms are, whether they're mild, moderate, severe, depending on their occlusion, what type of teeth they have, what type of bite they have. So there's different options that we use.
Why don't you show us a couple if you can here.
This is the option I like to use. It's called the Oasis appliance. I like this because it's probably the most comfortable, and there's nothing that really connects the top to the bottom arch. So you have freedom of mobility. You can move with this. You can talk with it. Not that you're really talking when you're sleeping, but it's very comfortable. And the way it moves the jaw forward is very, very reliable. I can also add to this, and in fact, I think I did on your appliance, options to make sure that the tongue stays forward as well. and also can open up your nasal passages a little bit. You have that on yours as well.
So
now,
the tongue is important in this
yeah,
process.
the tongue
right?
is what the tongue and the pharyngeal muscles are what collapses, and the tongue would fall back and the muscles collapse. So if we bring your lower jaw forward, that's great. But if we're not bringing the soft tissue forward with it, we're not getting the maximum effect from the appliance. Now, for medical insurance to cover these appliances, they have to be, first of all, custom made. You can't buy something off of TV or just put a stock appliance. These are custom made and they're titratable, which means I can adjust the position to get your mandible to the right spot to open up your airway most effectively.
And how do you determine that? So let's talk, before we go into my specific appliance, what is the evaluation process when you see somebody for making an appliance like this?
Right. Well, first of all, we have to take dental x-rays, make sure they're in good dental health. Consult with their dentist if need be, okay? Because your teeth have to be able to support this. Once we do that, we kind of see, we do a few different tests to see which appliance is going to be best for them, exactly what their problem is, and their sleep study is very important by determining what type of appliance is actually going to work the best for them. And then we take impressions, we take a bite, we make the appliance for them, and we deliver it, a few weeks later.
And does somebody have to have a specific mobility of their jaw to be able to, to be able to position it properly, or?
Yes and no, but a lot of people that, that's a good question, because a lot of people that have sleep apnea also grind their teeth at night. They go hand in hand. And people that grind their teeth at night have very, very tight musculature and sometimes have limited mobility. This appliance actually moves their jaw forward and moves their TMJ forward as well. So we actually help those people. So this appliance not only fixes sleep apnea, but also helps most TMJ problems.
Okay.
And you'll see their mobility increase once we start wearing the appliance, number one, and once they stop grinding, number two, if we get rid of their apnea.
So you talk about grinding, just explain that to people that don't understand what that is. People just kind of move their jaw during the night.
Grinding their teeth, or bruxing it's called,
Bruxing,
where people kind of gnash their teeth together, and it's directly related to sleep apnea. There's neurological reasons why I can't get it. I don't have time to talk about it now.
Okay.
But a direct correlation between the two. We stop the apnea, the bruxism usually ceases as well.
So the grinding can actually destroy your teeth too, right? It breaks
Without a
down
doubt.
the teeth.
Without a doubt.
So this will protect that as well, to help with that process. And so let's talk about my specific appliance. So I just got this, and I'm excited about it. And so there's a top and a bottom component, and
the bottom component was what the piece that you have in your hand does all the movements.
This does the work.
Right. The top component just protects your top teeth. Is all that does.
Got it.
That together.
Okay. So it's relatively simple to put in, and it looks a little awkward. What are these two little butterfly things here for?
Those are our nasal dilators. What they do is they actually, and when you put it in, you'll see, it does almost what we call a Cottle maneuver. Dr. Cottle was either an ENT or a chiropractor. What it does is it kind of does a movement like this and spreads your nasal aperture open. So it opens up your nasal valve, similar to the breathe right strip.
Yeah, I was just going to ask you. So the breathe right strip kind of goes exterior.
Right.
This is kind of
works from underneath. People that use this and a breathe right strip say they really opens their nose significantly.
Now I've found that I'm very, very stuffy in here, so hopefully this is going to open that up.
Usually
as well.
it does. You can feel that when you put that in, people feel their nose actually drain.
Okay.
And actually, a lot of people, like myself, are converted from being mouth breathers to nose breathers because this opens up their nasal passages, so now they can breathe through their nose.
Okay. Do you need any other? Before I put it in, because I'm not going to sound great. Do you need any other things to help with, say, like some saline or something in your nose, or any of that stuff? Will that help the process?
Usually I put most of my patients on like a sprayable cortisone as well.
Like a steroid?
Like a Flonase.
Flonase, okay.
Over the course of time, because that kind of gets rid of any inflammation in the middle nose, which this doesn't help.
Okay.
So if this treats the outer nose, if we treat the middle of the nose with an anti-inflammatory steroid to get rid of the inflammation, and the posterior nasopharynx is treated by us moving the mandible forward. So we kind of treat all the areas of the nose to get as much circulation as well.
And then what's the adjustment schedule or process for something like this? So I start wearing it for a few weeks, and then you bring my jaw out more and more, or when do you stop?
It depends. Sometimes the bite that I make this initially to is where I think you're going to be first of all, able to get used to the appliance, number one, and it's going to be open up your airway to a minimal degree.
Okay.
And then over the course of, let's say, the first 2 months, we try to titrate you, where we get you to the best level by your symptoms. You tell me how you're sleeping, how your snoring is, and then once we get to the ideal level that I'm happy and you're happy, then we send you for a follow-up sleep test to evaluate our treatment and make sure it's working.
And we would do that with that home unit again?
Most likely, yes.
Okay.
Most
And
likely,
while you're wearing the appliance?
without a doubt, yeah.
Okay.
Right.
And then the last part is just these things that just support the tongue, right? They're
Right.
not always necessary or something?
Not always necessary, but what they do is they actually keep the tongue up and forward. So I know when I'm bringing your mandible or your hard tissue forward, your soft tissue is coming forward on a one-to-one basis.
Okay.
That's the key. If your soft tissue is not coming forward, we're not getting our maximum effect.
Okay, so I'm going to put it in just so
Right.
everybody can see.
And this is the only appliance that has that. That's why this is approved by the FDA to treat mild, moderate, and also severe sleep apnea. Okay. So you got that, and you can talk. Mm-hmm. You got mobility. Mm-hmm. Yeah. Some of the old appliances, the complaint is that the jaws were locked together, and that's how they worked. But people didn't like that. They felt claustrophobic. This, you can move, you can talk with it. Not that you would, but so.
Okay, it's out. Yeah, pretty easy to put in, and there is a top component as well. That's very, very thin. It just pops in the top. The nice thing about it is you can travel with it, and
Without a doubt.
And once I get comfortable with it, I'll give you a little bit of feedback.
Good.
So now talk about the cost factor of this, and from an insurance standpoint, is this a dental insurance thing or is this a medical insurance?
Actually, this is a medical device, a medical procedure.
Okay.
So because I'm board certified in dental sleep medicine, and if we can show through a sleep study that you do have sleep apnea, most medical insurances will pay for this.
Okay.
You know, sometimes there's deductibles, obviously, with your insurance, but it's considered a medical device, and it's paid for by medical insurance.
And the only reason why you can get it done through a medical device is because your board certification in the sleep
Well, that's
medicine?
not the only reason, but it
Okay.
makes it a lot easier.
Got it.
If they know
Okay.
you're board certified, they don't even question it. They know you're
Okay.
doing the right thing for the people.
So not every dentist can really do this. You need to have this. You need to have this specialty.
Dentists can. A lot of dentists make what we call snoring appliances,
Oh, okay.
but they're not trained in sleep apnea. In order to become board certified, we had to do 200 hours of continuing education. We had to work in a sleep center, in a sleep
okay.
lab.
Wow.
We also had to follow around a sleep MD for a certain amount of time and pass a written and a clinical exam. I had to present a number of cases before and after showing, you know, that we are really changing these people's lives and stopping them from breathing. We want to get them breathing all night long without any apnea.
Yeah, and obviously when you start talking about repositioning the jaw and the teeth and everything, the skill set of the orthodontist is really important.
Right.
Otherwise, you might throw off somebody's bite, right?
Yeah.
When
Usually
when
not.
wake up.
Again, years ago, some of the older appliances, there were issues with tooth movements.
Oh, okay.
The way this appliance is designed and some of the other ones now, very rarely do we get any tooth movement, especially if it's controlled and especially if it's managed by someone who's trained in it.
And what is the cost of an appliance like this?
It depends. Insurance companies reimburse us anywhere from $1,800 to $5,000, depending on the insurance company, depending on how long we're going to see the patient.
Got it.
You know, we're going to see them for over 3 years at least, treating them, monitoring them.
Got it.
So all insurance companies are different. Medicare does pay for this.
Oh, it does,
as well
okay.
as most private insurance companies as
Okay,
well.
yeah, so that's
Right.
important for those Medicare, the seniors, may be another option for them. What about how long will it last? Does it need to be redone at a certain point, or does it break down? Or
I've had my appliance, this specific one, for about 3 years. Now, the insurance companies used to pay for one every 3 years, which I think is great, because after 3 years, you probably got a little bit of a new design you want to use, and they do, get worn out. Now it's 5 years.
Okay.
So we have patients that after 2 or 3 years, they need a new appliance because they want to change it, or sometimes it breaks. And sometimes medical insurance companies will pay for a new one at that point, as long as we can prove that the patient still has a medical need for the appliance.
Great. All right, so we learned a lot about all the various type of sleep disorders and what can be done to improve your sleep apnea. Our guest today was Dr. John Young. Dr. Young, thanks for joining us.
Dave, thank you.
We really appreciate it. And thanks again for joining us on You and Your Health. Until next time, I'm your host, Dr. David Bertone.